Yeah, I think that's actually the hardest thing to teach. And I think is the part that comes with the most experience. I mean, I really just want my interns after their first year to be able to look into a room and be like, is this patient sick or not sick? And like, that's it. Like, that's all I expect. And that's just after a year of all they do is seeing patients, right? So I think as you sort of move through training, that's really what you pick up on is, even though some people, yeah, you have a bone sticking out of your leg and be bleeding, but I was like, this is your compartment syndrome is more time sensitive than the bone sticking out the leg. So there's definitely experience that comes with understanding the disease process, what's going on, and why intervening as soon as you can to sort of prevent the long-term sequela and complications is so important. And that understanding who is the one that needs the attention first, that is truly the only thing that can come from experience. And there's nothing other than just doing it and seeing thousands of patients over a course of 7 years of training.
That's why there's no shortcuts, because
No.
it just takes that amount of time and that volume until you've seen enough of these, or even just to think about something that you may have never seen before, but it's in the back of your mind because at some point you learned about it.
It's so hard too, because in our training, there's so much graduated training. So you have like your intern and your junior resident, your senior resident, and then you get to me as the attending, and I'm there to make sure that everyone is in their appropriate level and doing things appropriately for their level of understanding. And it's very interesting to see the different decisions that a first year resident makes versus a fifth year resident. So training matters.
If you'd like to learn more about this topic, I encourage you to get the book Patients at Risk, The Rise of the Nurse Practitioner and Physician Assistant in Healthcare. It's available at Amazon.com and at BarnesandNoble.com. And if you're a physician and you'd like to learn more about getting involved in our mission, which is to advocate for physician-led care and truth and transparency among healthcare practitioners, please join our group. It's called Physicians for Patient Protection. Our website is physiciansforpatientprotection.org. Thanks so much, and we'll see you on the next podcast.